After hip or knee replacement surgery, patients play a big role in their own recovery. Joining us with more is Chris Adams. He's a physician assistant and clinical director of Orozco Orthopaedics. How do you know what the best therapy is for a patient after surgery?
Sure. So every patient has different needs. We like to evaluate each patient individually to identify their expectations and needs to help custom tailor a treatment program after surgery.
So what are some of the general things that you might recommend?
So we incorporate traditional physical therapy methods as well as patient participation via home exercises. Some patients are limited by activity level or other medical conditions, so we like to work with them to develop a way that they can maximize their therapy and outcomes.
So some patients might need a lot of physical therapy and others might not need any at all?
Yes, I think it really depends on the type of patient. There's a lot of different factors that go into how we develop a treatment plan. Some patients are more active and some are less active. They may have higher demands for physical activity. They may be a younger athlete, and in that case we would have a more involved physical therapy process.
How important is a patient's participation and motivation in getting back to their regular activities?
Patient participation and motivation is a major factor in success for surgical outcomes, and we believe that developing a custom tailored treatment plan is the best thing to do for each patient.
So if you want to get back to your regular activities, follow your plan.
You got it. Thanks,
That's
Robin.
the takeaway. Thanks so much. Chris Adams of Orozco Orthopaedics. I'm Robin Stoloff, and you're living well.